To document in QCPR, first you need to go ahead and log in. Today we're going to use our fake system, our dev system, but normally you would log into our prod system with your user ID. Once you have reset your password, you would go ahead and put in your user ID and password and click OK. Once you log in, you will get a pop-up here. You can wait for it to go away or just hit close, and it will display for you a list of patients in that location. The location of the patients will depend on where you're at physically, and it will display automatically. So my computer thinks that I'm living in med-surg, so I have all the med-surg beds. You can see I only have one patient here, but you can see he's an inpatient. Here is his MR number and his age and who the physician is. So on the main screen, you can open multiple patients. You'll notice that when I double click the name to open my patient, you'll notice that I still have this banner here up at the top. You can always click on the main desktop, the big house in the top left corner, and it will always take you back to be able to select a second or third or fourth patient. The patient that you originally opened, or when you open multiple, will stay open. They do not go away, as you can see here. We do not recommend leaving them open for extended periods of time, only because sometimes it holds up admission and discharge information going across back and forth, and that can cause an issue with the physicians putting in their orders. So I can go back into my patient here by clicking on the name. I do have a patient search option up here as well. If you need to find a patient that is in another unit, you can click it and open up the All Patients. Down here in this folder where it says Census, click it, and you will see all the inpatient units of the hospital. So if your patient got moved to a different area and you need to go and document something that was missed or check to see if something was done, you can always click on that particular unit and be able to see the patients in that area as well. Okay, so I'm going to close this. You can see that it does open up its own little tab. You can close them by clicking the little X. And I'm going back into my patient level. So at the patient level, you have your patient banner here at the top, your patient's name. Also, you have what's called a triangle, or caution triangle, that if you hover over it, it will give you your patient's allergy status, code status, etc. You can also click on it to make it stay up on the screen for a bit longer. And if they do have any allergies, you'd be able to see their symptoms and what type of reaction that they get. This is a patient I have not put a code status on, but if I did, you would be able to see it right below here, as well as if the patient was on any isolation orders, hemodialysis orders, or seizure precautions. So I'm going to click OK to close this. Next on the banner, you do have the patient's MR number, their visit number, location, age, date of birth, who the attending physician is, and if they have any issues with privacy. The first place it drops me into is the patient's inbox. Here's their communication tab, their MD to RN treatment orders, and a face sheet. This is all part of the inbox communication tab right here. You will be able to move through different tabs up here at the top by clicking on them, but this is the first one that it drops you into. The inbox communication tab is an application that will display for you any new orders that have been put into the system. You can see here you have 5 orders that somebody has put in, and they are alerting you to the fact that they're new. You will not do anything with this as a student other than being able to look at them. So a couple ways you can expand this. You can either click on the number 5 here or any of these numbers and it will expand the screen, or you can click on the arrow coming out of the box to open up the application. What this does is it will display for you all of the orders that are new to this patient. Okay, so you can see here I have 2 radiology orders, they are new. I have a wound culture, I have an order to transfuse if the PRBC if hemoglobin falls below 6, and also a new order for digoxin. You can see that these are all active. I also see on here any results that I would need to review, which I have an AccuCheck that was done and it is completed, and I would be able to go ahead and acknowledge that. You would also be able to see any discontinued or changed orders listed on this screen. Again, you would not be doing anything with this. It is only for you to look at, and basically when you're done, you can go ahead and click the little X right here. Don't click the top one, it'll close your entire patient, but just this little X down below. That will alert you to the fact of what kind of new orders you have, so that way you can go fill them if you need to. Stat orders will go to their own column right here. We don't really use the action column. Any results for the patient will come here, and any critical or abnormal values will show up in this particular column. You can click into that column, that number, and be able to see what it is by double clicking it to open, and you can see that the patient had an AccuCheck of 120, which was considered abnormal. That's why it's underlined in this screen and why it's bolded and underlined in this screen. If it had been a critical number, you would have seen it bold, red, and underlined. But again, you would not do anything with this. All you have to do is close this particular screen and come back to your other applications. The nurse communication application is meant to be a tool of communication between different caregivers. Physical therapy will use this, case management can see this, the nurses' aides can see this, students, as well as RNs and LVNs. So this is not a part of the patient's chart. This is just meant to be like a sticky note on the patient's chart that allows you to put notes on there that maybe you won't need once the patient goes home. It's also permanent and has to be removed if it is no longer active. If the patient has some kind of an issue with violence or something that needs to be kept from visit to visit to visit, this is where they would put that. This tells me that this order was put in, or this note was put in on the 26th to be NPO after midnight for surgery on the 27th. So I can see that and make sure that that gets communicated to anybody who has this particular application. We also can see items such as next of kin information that allows you to see the phone numbers right away and who to talk to. Passwords might be on there in case they don't want anybody to get information unless they know the password. So this is meant to be just a communication tool. You don't really need to do anything with it other than know that that's what it's for and you have access to see it. Right below that is the MD to RN treatment orders. Those are free text orders that the physicians can put into the system that we wouldn't be able to put in otherwise. So for instance, this one is to transfuse 2 units of PRBCs if the hemoglobin falls below 6. So this is a standing order. It doesn't need to be done quite yet, but if I am monitoring the patient's hemoglobin levels, I would be able to go ahead and put in the order to transfuse 2 units of blood if that number falls below 6. These are considered standing orders. They are also going to display in the patient's work list as an additional reminder. The face sheet is a place where you would be able to view a lot of different information being pulled into one place. So again, for this, I'm going to go ahead and launch this so it makes it bigger on the screen. But note that you can click through the tabs while it is small. So I'm going to go ahead and make this bigger. And from here, you can see that you can see information as admit date, diagnosis. If I put the code status in, it would display the isolation orders if there was any, if they have a preferred pharmacy, their diet order, height and weight. You can also see what date and time the height and weight was done to see if this is a current value, their BMI, if they have a Foley inserted, what their activity orders are, that they're supposed to ambulate and maybe be up in a chair for when they are eating. You can also move through the different tabs to be able to see the information. For instance, here are the allergies all over again, same information as what's in the triangle up top. Any other vaccine information, ADLs and activities. Once the nurse documents their ADLs as far as how many people are needed to either bathe or dress or feed the patient, then that will populate this particular area. And then you would know how many people are required, and you would be able to get the needed help before you actually go in to take care of the patient. You're also able to see any other precautions, such as seizure precautions, circulation precautions, suicide precautions, registration. This is their next of kin information, who's their surrogate person. Again, this is a fake patient, so we're putting in random information. Vital signs, AccuCheck labs. So this is the last set of vital signs that were put on the patient. If I had any labs on this patient, I'd also be able to see the date and time along with the values of those particular common labs. The last three tabs would be for when you are doing your rotation over an OB. So once a mom has delivered, you would be able to see, once the nurse documents, the maternal information, delivery information, and newborn information. So to close the face sheet, I can go over here under the name and click that little X to close the face sheet and bring me back to the main screen. The BCMA we will document in its own screen, but this is where we would go to document any meds that we need to administer to the patient. And this tab, the Med IV Summary Edit Cancel Meds, is where you would go to edit any of those meds if you needed to either cancel or edit anything on them. So the next tab over is the correct time reverse cancel. So if you cancel a medication and you need to get it back, you would be able to use the Med IV cancel reversal. And we'll do that when we document in the BCMA. You can do the same thing with correcting any time that you gave a medication or documented a specific event like a shift assessment or something like that. If you accidentally put the wrong time, that can be corrected in this particular application. The active orders tab. This is where you would be able to view all the active orders. And they're separated by categories. So here's your medications, here's your IVs, laboratory orders, radiology orders, nutrition, diet, and everything after that. So you would be able to see all of the active orders this patient has on them in one place. The next tab over is your patient's flow sheet. This would be where you would be able to see any vital signs on the patient. Also, their eyes and nose would display on here. This is hourly, so you can see it goes by the hour. This is a little more involved whenever you have an ICU patient. So when you do your rotation down there, you may be able to see like their art line and things like that, things that they take a little more vital signs options on. And here you have like your IV drips, things like that. So you'd be able to see all that information here. But this is a pretty short one. You'd also be able to see here's the patient's AccuCheck, and it also displays with bold and underlined, so that way you can see that it is abnormal. The OB flow sheet is the same idea, just not as involved as the other flow sheet that has a lot more information. This is more meant to show you the vital signs on the patient, and also if the patient is on mag sulfate, it will display this documentation in an hourly increment, so you can see how they're doing every hour. And the last tab over is your problem list. This we do not interact with. This is just for the physicians, but it is here for you to view. This is where they enter the ICD-10 codes. So for instance, this patient has an ICD-10 code applied of COVID-19. If this patient had other diagnoses that were put onto his chart that maybe you didn't see over here on the diagnosis, you would be able to see everything that they also entered in this patient's problem list. So on the left-hand side, you have what are called patient shortcuts. The first item is your work list. The work list is where you will go to actually document on the patient. You have access to document everything except for the shift assessment and the admission assessment. Those must be done by a licensed nurse. So you would not be able to access this. If I was to try to select it and try to document, there's no document button for me to select. So I can't even accidentally chart it. If I went into a regular routine charting, which is basically your every 2-hour charting, you can see here this goes by, here's your date, and then here's by the hour. If I went into the routine charting, you'll notice that I do get a document button. So from here, I'd go ahead and be able to document this particular entry. And you can see it is ordered on the even hour. Every patient has that on them. So you have access as a student to be able to document on any of these, except for the shift assessment and the admission assessment. And this is the patient work list. So if a nurse documents on the 10 o'clock routine charting, it will disappear off of your list as well. There are multiple people usually in the patient's chart. So when you go in and you notice that the routine charting is not here anymore and you want to put something in for 10 o'clock, you do have access to use the unscheduled documentation. This is where you would go to be able to document kind of like PRN charting, where you're able to go ahead and click that and select off the list. And we'll come back to that one in a second. So this displays again in chronological order. You are able to see all of the past documentation that hasn't been done. As it's been charted, it will fall off of your list. Once you have documented your entry, it will change from a scheduled to a verified, and then your instructor will then sign those off and they will fall off of the work list. Until that time, you are able to go in and make any revisions to your documentation. If your instructor tells you to go ahead and go back in, it will still be on this list and you'll be able to go ahead and change it. So I'm going to come back to, we're going to do documentation in a separate tutorial. So I'm going to go ahead and close the work list for now. Again, this is your unscheduled documentation. So this is where you would be able to document at any time. Here is your shift assessment as a student. So even though you can't do it off of the work list, this is the student version of the shift assessment. Here is also the routine charting that if they documented it off the work list and it's no longer there, you would be able to document it from here. Any activity you do with the patient, hygiene activities such as bathing the patient, changing the bed linens, you'd be able to document that separately here. Eyes and O's are right here if you go and start an IV, if you change a diaper. If you want to use the nursing note, that one's a free text note, so you can type in whatever you want. If you are in a different unit, you have the shift assessment for peds and the routine charting for peds. Also, when you go to the ICU, they do have a separate routine charting, so you would need to use that separate one if needed. When you do your rotation in OB, they also have their own shift assessment for labor, postpartum, newborn, and then the routine charting for OB and newborn. If you wanted to do a set of vital signs or just individual vital signs, you have that option down here as well. And we'll come back to that when we do the charting tutorial. The next shortcut is the chart review. So the chart review is where everything goes to live after it has been documented. So if it is grayed out on the number, it means there is nothing behind it. So I can click on it and it doesn't have anything to show me. So if I go to the all nursing, I'd be able to see all of the nursing documentation, whether it's been scheduled, which are the blue ones, or if they've been complete or canceled, which would be in black. And they do say complete right here. This is also where you would be able to go to view any transcription by the physicians. So you do have access to see the patient's H&P right here, and here are the progress notes. I don't have anything on this particular patient. This is a fake patient, but I would be able to see that from here and open it up and view their information. You also have access to be able to view any of the ancillary documentation. Much of this is already on your shortcuts here. So the laboratory right here, laboratory is the same as this labs list right here. So we just pulled it out into the shortcuts. Same thing with the radiology. That's the one we have here for radiology review. But if you wanted to see the documentation from case management or maybe nutrition services or the pharmacy, you'd be able to see that information displayed in its own section. You can open as many shortcuts as you want and they will stay open. You can see here I have my chart review open, and also I have the unscheduled procedures still open. So I can move around and be able to do other things. Even though I have this one open, I can close them as I need to, but I can open multiple shortcuts if I need to jump around. The next item down is your provider info. So this is who is taking care of this patient. Here's your admitting physician, attending physician, and consulting physician. Now this can change from day to day, so but this lets you know who is taking care of the patient if you need to keep an eye out for him. The iSirona Vital Signs students don't do a whole bunch with, so we're going to skip that one. Jump into the vital signs trend. This is going to display for you all of the patient's vital signs, and the most recent will always be at the bottom. So it's just going to work its way down. So here you can see I have the different columns for temp, pulse, respirations, blood pressure. Here's also a column for the finger sticks. Here's my O2 sat, and then my O2 rate, and if I used any oxygen. Their pain level, and depending on what scale you used, as well as their weight, and if they've had any bowel movements, will show up over here on the right side. So here I have my vital signs trend. We really don't use this other than just to look at. We don't have any way to change these from the screen. It's simply to look at. So I'm going to close that. The next one down is your INO display. So I can view all of the INOs for my patient by shift. So here you can see this is for August 26th, 0700 to 1859. This was for the night shift the previous night, and then this was for the day shift yesterday. So this separates it into different categories. I have my intake here, and I have my oral. Here's my IV, and it gives me a total here. Here's my output for urine, and my output with my balance is a -50. If you want to see what they documented in order to enter this data, there is a button at the bottom that says Review Assessment Data, and you would be able to see all that information. Here I documented the patient had a Foley with 200 mLs out, and the urine was yellow. They had 50 intake with water. You would be able to see that information without looking too far. So I'm going to go ahead and back up. I'm going to click my back button, and the back button will always move you backwards. Be careful when you do use it, because if you haven't saved something when you are documenting, it will kick you out of it. Below the INO display is the nursery vital sign in INO. This, when you go over into OB, you'd be able to see for the babies specific information that they document on that is different than the adults vital signs trend. Same type of format where you have the most current will be at the bottom here, and it also includes the pain scale that they use for the babies, which is the NPAS. And they also show their breastfeeding time, bottle and gavage feeding, IV intake, trans-bili values, and bowel movements and voids. So it's just a little bit different, but we separated that out for the babies in the nursery so they can see in real time what's going on. So I'm going to close that, and we go into specimens. So the specimens we're going to document in a separate tutorial. So I'm going to skip down into the labs, and this is what it will look like for the list. You can see all of the labs that have been ordered with the name. If they are still scheduled, they will be blue like this, and if it's been canceled, you can see that. If it's been completed, you can view it here. You can also see if the item is abnormal or critical. It will be red, bold, and underlined if it's critical. But you can also view any lab results from here as well by just double clicking the item to open it up. And then you would be able to see the values. You can also see the normal range right next to it in blue, and that lets you see all of the patient's lab values. So I'm going to close that. The laboratory review is a little bit different from the list. The list just gives you a list of all the labs that were done or are planned to be done. This is going to display for you anything that has been done but broken out. So you can compare. This is not a great example because I don't have something simple like a CBC or BMP display. But if they were done, you would see it in 4-hour increments. And if a CBC was done daily, you would be able to compare all those values across time. So it makes it a little bit easier to see if the patient's vital sign or lab values are getting better or worse, etc. So that's what the laboratory review does. It just kind of breaks out all the values here. Now you'll notice here at the top there is a row called laboratory and it has 1 out of 3 and it is bolded. If I double click it, it's going to display for me the 1 item out of 3 that has been completed. So that's what that means. I have 3 tests and only 1 has been completed. So here I have my complete, and again, it's going to be bold and underlined if it is abnormal, and red, bold, and underlined if it is critical. But these 2 are still scheduled, and I do not have a result yet. If I did, I would be able to double click it and see the result from here. So that is the difference between that and laboratory review. Microbiology review is the same idea as the labs list, where it gives you a list of all of the micro tests that have been done or if they are still scheduled. So for instance, we ordered a wound culture and it has not been done yet. It's still scheduled and we need to go ahead and collect that and send it to the lab. So once you get a result come back on that, then you would be able to see the result here if it was completed and be able to also view the resistance and susceptibility. Radiology review, same idea. Again, has your list of all the radiology tests that need to be done or have been done, and these 2 are still scheduled. So I can see the results once this comes back from the radiology system. I would be able to open it up and be able to review the report to see what's going on. The consolidated med list, this is where you would be able to see all of the patient's meds. Their home meds are right here, the very top. It says home medications, and it gives you an H in that particular column. This is the visit med list. So here you have this column with V's, and these are your visit orders. So you can see what they're currently on in the hospital. And once they have been cleared to discharge, the doctor will put in the discharge medications and they will be listed here as well. So this you would be able to view at any time and it will update on a regular basis if it needs to be, if it's been changed. You can also refresh the screen by clicking on the little double arrow here in the top right corner. And if any changes, you would be able to see them right there. You look up the drug information and print for the patient. So on this particular list, you have your lisinopril, and if the patient has any questions about it, you can select it, just one click, and go down to the bottom left-hand corner. It says drug info. It may give you a couple of different options, and you can, if it's for you, you can put professional. If it's for the patient, I believe that's a default. So you would then go ahead and pick lisinopril and say view selected. You would be able to have the option to print even if you just say view first, so that works fine too. And then it will bring back the information, what's it used for, etc. And then you can hit print if you really wanted to print it and give it to the patient if that works. I'm going to hit close just to make it go away. So that is the consolidated med list. The med reports are where you would go to be able to print out a report when it's time to go ahead and pass your meds. Obviously, we need to make sure that you are using the computer in real time to scan the medications and also make sure that the medications are still active, haven't been held, haven't been discontinued, and you would be able to use this piece of paper, this report, to take with you to the Pyxis with your instructor and pull the medication out. So for this one, we would start the date and time of when you want that report to start. So for instance, if you start your shift at 0700, you would simply type in 0700. You don't need to put the date. If you just put the time, it's going to default to today. So I can go ahead and say OK. And you see that it does put in today's date. The stop date and time would be the end of your shift. So let's say you go home at 1500 and you say OK. Click on that and it will print to the nearest printer. On this particular report, it will display for you the names of medications, their dose, their frequency, any other instructions. Here's the indication of why you're giving it, and here's the instruction to infuse over 30 minutes. For something like the sliding scale, it gives you a list of all the ranges, so you would be able to see how much you were supposed to give for the range, which is helpful when you go to drop the insulin in the med room. And also here is the IV that needs to be documented as hung. This one is red because it's saying it's waiting for review from the pharmacy. So the medication has not been signed off by pharmacy yet. Therefore, you would not be able to even pull it from the Pyxis until that's done. So that's just for you to a visual. Obviously, we don't print in color. This would be in black and white, but it still tells you what's going on with that particular med. So once you hit print, it's going to send it to the printer. I'm going to click OK to close it, and you would be able to get that piece of paper. So if you need to print it out again, you are able to print it as often as you need to. Just put in whatever time ranges that you want, but that is obviously going to be obsolete if the physician makes any changes to the existing medication list. So that's your med reports. Sometimes from in the background holding up a session, sometimes it won't let you back on because it thinks you already have a session open, which can happen sometimes when you use the X in the top corner. So the best practice is to actually use the log off key to be able to log you off of the system. And then you would be able to go ahead and cancel and close this. In the next tutorial, we'll go ahead and cover medications as well as the documentation.